The value realization framework is really a balanced scorecard approach that was based on Dr. Norton and Robert Kaplan's balanced scorecard approach based out of Harvard Business School. And what we did was we took their groundbreaking work and we tailored it specifically to a healthcare organization to determine whether or not they're making success. And we do that by being able to look both horizontally and vertically across the organization to figure out if it's in total alignment with what success looks like for that organization. I mean, because that value realization framework is really what makes us unique. You know, we took the balanced scorecard approach that Dr. Kaplan and Norton created at a Harvard Business School, and we were able to tailor it to a healthcare organization by focusing on 6 perspectives for the organization versus 4. And in doing so, we're able to get total alignment with the organizational success as it's defined by the executive management as well as the rest of the staff. I can look at both the clinical outcomes and then I can see how it's got its impact on the process as well as whether or not the organization needs to learn and grow and in what capacity to deliver the overall value that matters most, not just to the organization, but to the patients themselves and their condition. And it's kind of revolutionary because it also ties into an analytic platform that can be used to monitor the overall value and cost within an organization. So what makes the framework unique is, you know, under Kaplan, they have 4 perspectives, which are the financial, the process, the learning, the growth, and then the customers. Well, we know within healthcare organizations, there's really 6, right? The first is the clinical outcomes. Then the second one would be the clinician satisfaction. Why is that important? Because organizations right now are struggling with recruiting, retaining, and retraining of key personnel. I mean, it's no wonder that people are company jumping 11 to 15 times in their career. And so healthcare organizations aren't like any other. They need to keep their good quality people. And so you can monitor satisfaction as well as how well they're doing in terms of delivering the outcome. The other perspective is the patient satisfaction. You know, we can talk about net promoter score and these other things, but really it's in the subjective eyes of the patient and whether or not, you know, you're delivering that desired outcome, and then how do you actually improve upon it. And why that's important is because that's what's going to lead a healthcare organization to get more patients in the door that want to see them. Why? Because they know they're going to get the delivered value that they expect and that they deserve. The other perspective we have is financial. It's unique for us because we use time-driven, activity-based costing to actually measure that specific minute of cost so an organization can have the right resources at the right time and place to deliver the desired care. And that's unique and different than the old RDV model or the ABC model that organizations traditionally use. The other perspectives we have are learning and growth, as well as process improvement, which is key. The way we've devised the process improvement is within our tool and framework, we actually use a blend of A3 thinking, Six Sigma, and Lean methodologies to really get at the heart of the process so that you can improve your organization in a continual and real-time way. The other thing that's unique about the framework is, you know, I think we're all blessed to have really good mentors in our lives. And one of my mentors asked me, he says, what does success look like? And if you can't articulate it in a clear sentence, then you're probably never going to meet it. And so our framework is unique because it does start with the mission, the vision, the values of your organization, but then it breaks down to the actual strategies and the initiatives that you're trying to achieve and creates a critical success factor off of it that everybody within the organization can understand and everybody can strive to achieve. And then we put in objective measurements, or what I call key results indicators, so you actually have your talking points of outcomes to show that you're actually meeting that success and those initiatives or strategies that you're trying to achieve. So it's quite unique. Embedded in that, we have our performance indicators, and there are actionable key performance indicators that you track in real time if you're using the right analytic tool, like a Value Explorer. The thing that's differentiating us from other balanced scorecard type approaches is that I've also seen that when we talk about health IT, you know, IT is normally its own little sector and it kind of does its own thing. And then on the left, you have the quality and safety folks within the healthcare organization focused on like the clinical outcomes piece.